Cats tend to have more frequent rhythmic gallbladder contractions than dogs, and any amount of sedimented sludge in a cat gallbladder is considered to be abnormal. About 75% of cats with gallbladder sludge on ultrasound have hepatic or biliary disease. Occasionally, the gallbladder may be difficult to find because it is completely filled with sludge. This is not considered to be normal and may represent delayed emptying. This video is from a 13-year-old spayed female mixed breed dog showing anorexia, weight loss, and elevated bile acids. The gallbladder is almost completely filled with sludge and difficult to differentiate from the liver parenchyma. Inspissation is sludge that has been further dehydrated or concentrated to a more crystalline form. Sludge appears as a gray sedimenting mass on ultrasound. Inspissation is hyperechoic or white compared to sludge. It is heavier than normal bile and sludge and should sediment. Because it is heavy and crystalline, inspissation appears to irritate the gallbladder wall, which produces more mucus to protect itself. Inspissation indicates an abnormal gallbladder. Choleretics such as Actigall, SAM-E, Denemerin, or milk thistle should be given to thin bile secretions from the liver. This video is from a 16-kilogram, 13-year-old female Sheltie with a gallbladder volume of 107 cc's. If inspissation has been present for some time, it may become embedded in the gallbladder wall or become mixed with mucus and adhered to the gallbladder wall. When the patient is placed in dorsal recumbency, some inspissation sediments by gravity and some is adhered to the ventral gallbladder wall. With time or ballottement, some individual crystals may break free of the ventral wall and be seen falling through the normal bile to the dorsal gallbladder wall. Falling crystals indicate an abnormal gallbladder. This may be the earliest form of a mucocele. Choleretics should be given. In the normal standing position, sludge and inspissation sediment to and remain on the cranial ventral gallbladder wall. When the patient is placed in dorsal recumbency, the sludge and inspissation should sediment to the dorsal wall of the gallbladder. If the gallbladder wall is irritated and forming mucus from chronic exposure to inspissation, some inspissation and mucus will remain adhered to the cranial ventral wall as though it is glued there. This inspissation will slowly pull free and begin to fall to the dorsal wall in thick streams or rope-like strands. This streaming inspissation indicates an abnormal gallbladder. It may be the next step in mucocele formation. Choleretic should be given. The series of videos in this section is from a 10-year-old, 28-pound Cocker Spaniel showing daily vomiting of yellow bile. The gallbladder is enlarged, but the wall is normal, a thin, smooth, hyperechoic line. The gallbladder contains anechoic bile, sedimenting inspissation, and streaming inspissation from the cranioventral wall. In this video, the sedimenting inspissation has moved into the cystic duct. The dog's symptoms of daily vomiting stopped when he was placed on SAM-E, but recurred if the owners stopped giving SAM-E. On subsequent ultrasound examinations, the gallbladder size and contents did not appear to change in spite of treatment. Because sludge and inspisation are heavier than normal anechoic bile, you should never see a pocket of what appears to be anechoic bile surrounded by sludge or inspisation on ultrasound. This finding indicates a mucoid plug or large amount of mucus produced by an abnormal gallbladder wall. Studies suggest that once the mucus-producing cells of the gallbladder wall become hyperplastic, they probably never return to normal. Eventually, a mucocele will form. Mucoid plugs can obstruct the cystic duct and the common bile duct, resulting in symptoms of abdominal pain and vomiting. Choleretics should be given, and consider cholecystectomy. To the naked eye on surgery, a mucoid plug looks like a blood clot or piece of jello. This video is from an 8-year-old 21-pound poodle showing chronic hematuria. Blood work was normal, and the gallbladder abnormalities were an incidental finding on ultrasound. The dog underwent surgery to remove cystic calculi found on ultrasound. The gallbladder could not be manually expressed during surgery, so the gallbladder was also removed. It is not certain how gallstones develop. However, if inspisation mixed with mucus, especially in the cystic duct, is compressed by a gallbladder contraction, a concretion or gallstone could be formed. In humans, gallstones are often formed of cholesterol and can be dissolved by Actigall if they are not mineralized. Gallstones in dogs and cats are not formed of cholesterol. Gallstones are gravity dependent and have an acoustic shadow. If the gallstone obstructs the cystic duct during a gallbladder contraction, immediate pain and vomiting occur. If the gallstone moves out of the cystic duct, symptoms resolve. Symptoms can be cyclical. Surgical removal of the stones and the gallbladder are probably best. This video is from a 12-year-old 39-pound mixed breed dog with fever, a hematocrit of 29%, and a white blood cell count of 30,000 with a left shift. Sepsis was suspected. On ultrasound, the liver was enlarged and generally hyperechoic. The gallbladder was small, and the wall appeared roughened and thickened. It contained a small amount of streaming inspisation and a gallstone. A right adrenal tumor was also identified. The gallstone was an incidental finding in this case. Very small gallstones may not show an acoustic shadow. This next video is from a 12-year-old 31-pound beagle showing hair loss, panting, increased appetite, and an elevation of serum alkaline phosphatase. On ultrasound, the liver is enlarged, hyperechoic, and contains a cyst to the left side of the screen along the diaphragm. The gallbladder is not enlarged, so does not appear to be obstructed at this time. The gallbladder wall does not appear thickened. The gallbladder contains a very large gallstone with a large acoustic shadow. It also contains sedimenting inspisation, streaming inspisation, and a mucoid plug to the left side of the gallstone. Cushing's disease was the primary diagnosis in this animal, but ultrasound revealed multiple abnormalities that required treatment. Gas is not supposed to be in the gallbladder. Its presence indicates bacterial contamination of the biliary system. Retrograde movement of gas-producing bacteria from the duodenum through the common bile duct is one explanation. In the first video, a single gas bubble is seen rising to the ventral gallbladder wall in this patient placed in dorsal recumbency. In the next video, a small amount of gas artifact mixed with sludge is suspended in the gallbladder and seen along the ventral gallbladder wall in this patient with porcelain biliary tree, a bacterial contamination and mineralization of intrahepatic bile ducts. In the next video, a large gas artifact is in the cranial ventral gallbladder, while multiple small gas artifacts are spread diffusely throughout the gallbladder contents. The gallbladder wall is also thickened, suggesting cholecystitis. Antibiotics, choleretics, and cholecystectomy are indicated, and prognosis is guarded. Mucus glands in the gallbladder wall produce mucin to protect the luminal epithelium from cytologic effects of bile acids. In dogs, excessive mucin can lead to mucoceles. Cats have fewer mucus glands in the gallbladder wall and do not tend to form mucoceles. A gallbladder mucocele is an accumulation of a greenish-black, bile-laden, semi-solid to immobile mucoid mass within the fundus of the gallbladder. About 20% of gallbladder mucoceles in dogs seem to be incidental findings on ultrasound. This 5-pound spayed female Chihuahua was first seen at 7 years of age for suspected abdominal pain and anorexia of several days' duration. Amylase and lipase were elevated. On ultrasound, the gallbladder contained inspisation and mucoid plugs. The gallbladder was enlarged with a volume measurement of 5.4 cc's. 2.5 cc's was expected. Pancreatitis was suspected as a primary diagnosis, although no ultrasound lesions were seen to support it. Long-term Denamarin and gallbladder removal were recommended after the patient recovered from symptoms. 1 year later, this same dog was seen for cyclical abdominal pain, anorexia, and hematuria. The gallbladder was still enlarged and contained inspisation and mucoid plugs. Renal mineralizations were also seen. The owner had discontinued Denamarin, so it was reinstated. Gallbladder removal was still recommended. 2 years after the original exam, the dog was seen again for intermittent abdominal pain, diarrhea, and anorexia. The owner had discontinued Denamarin again, but noted that the dog seemed to be better with pain relievers. Ultrasound now shows an obvious advanced mucocele with a stellate pattern. The mucocele was surgically removed and the patient's cyclical symptoms resolved. The stellate pattern of a gallbladder mucocele is caused by the overproduction of mucus from some portions of the gallbladder wall, which compresses the centrally located echogenic bile, either sludge or inspisation. As more mucus is produced, the echogenic legs become further compressed and form fine striations. This advanced form of mucocele is often described as a kiwi fruit appearance. Not all mucoceles have a stellate or finely striated pattern. In this mucocele, echogenic bile is compacted in the center of the gallbladder and surrounded by an anechoic rim of mucus. When this gallbladder was opened after surgical removal, The central ball of inspissation crumbled with digital pressure like a clod of dirt. Any gallbladder containing a non-mobile, non-sedimenting, echogenic bile on ultrasound should be considered to be a mucocele. In one study of dogs with gallbladder mucoceles, half of the dogs taken to surgery showed obvious loss of gallbladder wall integrity and/or gallbladder rupture at the time of surgery. However, gallbladder wall necrosis was identified in 9 of 10 dogs by histopathology. Surgical removal of mucoceles should be recommended rather than medical treatment. This video shows abdominal effusion and fluctuating inspissation protruding through the gallbladder wall.